Greetings, I am Dr. Yash Patel. Today, our topic is Lantidra, the first FDA-approved cellular therapy to treat type 1 diabetes. It is my indeed pleasure to represent this talk to all of you and thank you for joining for these wonderful interactions. Hope my slides are visible to you. If any concern, you can connect to the technical team and I'll just take the whole slides to you in a representation. So why Lantidra? So Lantidra is one of the advantage in type 1 treatment that is upcoming to ourselves, and we can do plenty of things to explore this kind of science in upcoming days. So when I started my clinical practice post my fellowship from University of Buffalo, UBMD, my professor enrolled me to the University of Alberta for advanced protocol for islet cell transplant. And from there, when I returned, today I learned plenty of things about Lantidra with collaboration with University of Illinois at Chicago and University of Illinois Hospital in association and collaboration with Celtrans and Vertex. There are plenty of supports and collaborations we have. Now, this is the first FDA release for the Lantidra, which represented the cellular therapy approval in type 1 diabetes care. That approval came in March 2024, and it has been represented as allogeneic pancreatic islet cellular suspension for hepatic portal vein infusion. So if I specifically talk about what is Lantidra, so Lantidra is one of its synonym is Donicel, even VX880 or VX880. It is allogenic stem cells derived fully differentiated insulin producing islet cells. Specifically, what are the indications for Lantidra to use for? So it is used for the treatment of adults with type 1 diabetes, specifically those who are not achieving appropriate targeted HbA1c with intensive diabetes management and education, and they'll end up recurrently in episodes of severe hypoglycemia. So if we talk about how it works, so the Lantidra is administered through infusion to hepatic portal vein, designed to restore pancreatic cell function. What are Lantidra cells' intended effects are? They sense the blood glucose level like pancreatic islets, produce and sustain secrete insulin, regulate blood glucose level, as well as restore. Their aim is to restore natural insulin production and glycemic control. What are the indications specifically for Lantidra? So if we see, what are the primary indications for Lantidra? So specifically, I am repeating it again, adults with type 1 diabetes, and despite of intensive diabetes management education, these adults are unable to achieve target A1C because of current repeated episode of severe hypoglycemia. This hypoglycemia unawareness of level 3 hypoglycemia. What are the limitation of use of these indications? So the well-controlled type 1 diabetes, the risk and benefit ratio to be managed. Patient with hypoglycemic unawareness, but using intensive diabetes management, they are able to prevent recurrent severe hypoglycemia, and getting into the control is possible. Even prior portal vein thrombosis, these are the limiting use factors for its usage. And patient with liver disease and renal failure, we can't use it for further level. Further ahead, what are the eligibility factors or patient selection factor for Lantidra? So adults with type 1 duration 5 years with severe hypoglycemia episode, impaired awareness of hypoglycemia, and failed to achieve glycemic control with standardized treatment. So treatment protocol, it doesn't involve only infusion. It starts from cadaveric pancreas products, then productions, then procurement, then Lantidra manufacturing, patient screening and preparation, infusion of Lantidra cell, immunosuppression regimes, and close monitoring and follow-up with this Lantidra. So this is one of the slide representing the acquisition from the donor to manufacturing and providing to the recipient. So cadaveric pancreas procurement is done. Screening and verifications along with acceptance of this pancreas, decontamination, perfusion, digestion, tissue purification, islet culture, and quality assessment and formulation to be done, and then transfuse this pancreatic islet lentidra to the pancreatic recipient. So the donor is taken care. But further ahead, how it is this different from the Edmund protocol? So UIC protocol has a difference from Edmund protocol in form of immunomodulatory regimes, islet purification, requirement of intrahepatic islet transplantations, even the reduced islet mass is also noticed into UIC protocol, and this is a steroid-free maintenance with immunosuppression. So islet transfusion for brittle type 1 diabetes, what UIC protocol represented. So this is one of the article present and it showed UIC group required fewer islet compared to Edmund protocol. Yes, insulin independence as well as normal A1C and significant reduction in hypoglycemia has been achieved. What is the dose of Lantidra? So 5,000 equivalent islet numbers per kilogram in the initial infusion to be given to type 1 individual. In subsequent infusion, that could be reduced to 4,500 equivalent islet numbers, and the dose is restricted to 10 cc per infusion. That leads to almost 10 lakhs per bag. How to be prepared pre-procedurally in this individual? So 360 to 30 minutes prior Lantidra infusion, the antibiotics as well as anti-IL-2 receptor antibodies, calcineurin inhibitors, mTOR inhibitors, or TNF factor blocker, all to be initiated in the individual. Even preparation for Lantidra, it to be kept between 15 degree to 25 centigrade for less than 6 hours from the product release. Do not irradiate. Use Lantidra as supplied without further dilution. Even pre-infusion, patient preparation involves prepare to manage any potential emergency. That could be hemorrhage, portal vein thrombosis, allergic reaction, glycemic variability or liabilities, bleeding, pain, anything. Even hydration of the individual is much more. The Lantidra is brought into two bags. Lantidra is a cellular suspension and the rinse bag contains the transplant medium. So both can be added and transfused into the individuals. The make sure the leukodepleting factors are not used during the administration, and optimized viability of Lantidra could be possible with as early as infusion after the product release. Even Lantidra is an to be administered into the interventional radiological suite or operating suite with aseptic conditions. So performance of all steps to be done in the aseptically environment. The use of 5 to 6 French angiographic catheter along with catheter length to be restricted 65 centimeters or less, and internal diameter of this catheter to be kept to 0.97 mm or greater. Even Lantidra infusion procedures, insert catheter into the portal vein, gravity flow over approx 30 minutes to be looked into, monitor during Lantidra infusion that specific portal pressure to be monitored along with mean blood glucose level and portal vein branch thrombosis. Portal pressure, why so? Because the portal pressure to be maintained around or below 18 mm of Hg. If this portal pressure rises above 22 mm of Hg, then hold the transfusion for 10 minutes to make sure that portal pressure returns to 18 mm of Hg. Even if there are chances of portal vein branch thrombosis, then heparization to be taken care if needed. Monitor this patient for 24 hours. Use USG abdomen on day 1 and day 7 for follow-up to look into any complications. monitor for glucose, adverse reaction. Even post-infusion medications could be antibiotics to anti-infective medications, anti-inflammatory medications to anti-IL-2 receptor antibodies, TNF blocker to be administered with immunosuppression therapies and to be managed according to the protocol of individual's health. Long-term medication includes immunosuppressions as well as avoid systemic steroids. Contraindications or risk involved into the Lantidra. So concomitant disease or comorbidities or conditions and pregnancies are real contraindications. There are risks involved with Lantidra when donor-derived infections are potentials. The risk related to procedure of Lantidra could be bleeding, portal vein thrombosis, elevated blood pressure, and contraindications or risk of immunosuppression includes opportunist infections, lymphoma, malignancies, as well as severe anemia all around. Even the donor BMI and cold ischemic time can be key factors for predicting of islet cell yield and its dosage required to individuals that could be in the background for the same. The adverse reactions. 19% of subjects had at least one serious adverse reaction, and that is due to infusion procedure or immunosuppression. Infusion procedures could end up the elevated blood portal pressure or liver laceration, hematoma, hemorrhages, or intraabdominal bleeding. But immunosuppression has effect of infection as well as malignancies. What are clinical outcomes available for Lantidra? The phase 1 and phase 2 clinical trial represented key findings that significant reduction of HbA1c, decreased exogenous insulin requirements, improved target uh, glucose range is noticed as a key finding. What significantly represented was 60% of these individuals were exogenous insulin free for 5 years. So they did not require outside insulin. There are plenty of clinical trials had been looked into for isolations, donors, and all around. So this is one of the trials where intraductal glutamine administered reduces oxidative injury during human pancreatic islet cell infusion. It increase islet yields, reduce apoptosis, improved islets graft functions, and faster time to normoglycemia. Even there are protocols developed from North American institutes for islet donor scores. Why so? So that investigate the manufacturing procedure affecting islet cell isolations, and it implicates that improved islet cell isolation outcomes through optimized manufacturing procedures could be possible. Even there are clinical studies looked into for the longevity of these islet cell transfers. So one study represented 5-year follow-up of patients with type 1 diabetes transplant with allogenic islets that the UIC experience. And even one case is of over 10-year insulin independence has been documented well in the publications. What key outcomes noticed for 5 years where 100% patients achieved insulin independence after 1 to 3 years of transplant. 60% of patients remained insulin independent at 5 years. 70% maintained positive C-peptide level and improved hypoglycemic score and A1C noticed into the individuals. Even enhanced beta score indicating improved insulin secretion is also noticed. So there are plenty of clinical trials where improved outcome of islet cell isolation and transplantation by use of novel hemoglobin-based O2 carrier, even improved human pancreatic islet cell purification with refined UIC UB density gradient, even the North American islet donor score comparison and all trials, even improved albumin concentration reduces the apoptosis and improve functionality of human islets has been documented in different clinical trials. Now let's look at the comparison of this Lantidra with available treatment for type 1 diabetes is insulin therapy. And the advantage of Lantidra with insulin therapy is potential for insulin independence for type 1 diabetes. Friends, improved glycemic control, reduced risk of severe hypoglycemia. But above that, the type 1 documented that enhanced quality of life for type 1 friends is noticed. There is a clinical trial available which represent improved health related quality indicators of life in phase 3 islet cell transplant trials in type 1 diabetic who are complicated with severe hypoglycemia. The key finding represent 87.5% achieved freedom from severe hypoglycemic events, and achieved glycemic control along with it by 1 year. Even significant improvement in diabetes distress scale, hypoglycemic fear surveys, or EuroQL 5 dimensions visual analog scale has been noticed. And these improvements are sustained at 1 year and 2 year post transplantation. So these were 2 years monitoring. Now, long term achievements are to be looked into. So, long term outcomes and follow are important, and regular follow up and monitoring post transplant is required too. Long term benefits are related to quality of life and reduced complications. What could be looked into the ongoing studies and research? The future direction and research could be looked into to optimize this treatment to potential for combination of therapies. Even exenatides, GLP-1s, has been looked into this type 1 friends along with Lantidra. Even different immunosuppressions and immunomodulators has been looked into to make them steroid free or with lesser complications. Even exploration of alternative cells sources has been tried into. Even development of encapsulated technologies VX264 to make sure to requirement of immunosuppression to be reduced in that line has been tried and looked for. Research into stem cell derived islet cells, even reducing the need for immunosuppression, are in line. Next step could be clinical trials and advantage, making the Lantidra more widely available could be possible. Here I am sharing one case which represent over 10-year insulin independence following single allogenic islet transplant without T cell depleting antibodies. It's in the line. You can go through this article by scanning this QR code that is available in PDF. The case was of 35-year-old female with a situs inversus with type 1 for more than 26 years, complicated by severe hypoglycemic awareness and even recurrent severe hypoglycemia. The individuals received islet cell transplant at UIC hospital, and then these individuals were free from recurrent hypoglycemia, even hypoglycemic unawareness. The individual's A1C has reduced over time, and the article also shows how the GAD antibody reacted over time. Even there are many patients' testimonies. The type 1 diabetic friends testimony is available on scanning this QR code. You will be able to see there are patients' testimony who have specifically come out and represented how their lives after Lantidra over 10 years, 15 years. So in nutshell, Lantidra represents significant advancement in type 1 diabetes treatment. Even it offers us a new hope for friends with type 1 diabetes who have difficulty to control uh, without hypoglycemia the sugars. Even continued research and clinical experience will further refine its role in diabetes management. But at last, we can thought of Lantidra has the potential to change the standard of care in diabetes management. With this, it is my pleasure that health ecosystem is one of the key fundamental where we can evolve with such therapies. You can put the request for plenty of therapies where our empathy, empowerment, evidence-based treatment for everyone and everywhere could be possible. Even the diabetes ecosystem is lifelong. So all healthcare providers are part of it. The collaboration of resources and infrastructure could give us access to real-time management, and that could give us real-time research with aggregated format. In a line of achieving excellence in diabetes management, we can look for health ecosystem to advance in the further line. If you want to know about how Lantidra or specifically related to its awareness, you can scan this QR code and do communicate to me to my Instagram portal. I appreciate your efforts to joining. This is our Project Krishna, where you can be part as a Sarthi after getting trained as Sarthi to mentor type 1 friends. With this note, in contribution to Project Krishna, I sign off. Dr. Yash Patel from Swasthya Diabetes Care. મળીએ. If you have any questions, you can connect to us, do write to us. You can put it into this course or on my Instagram portal or any communication. We'll connect to you. Thank you.